Millions find comfort in faith, but when does a divine message signal a mental health crisis? In some cultures, what doctors call psychosis, a community might call a spiritual gift. This could mean truly believing you are a prophet sent on a mission from a higher power. This confusion can be dangerously isolating, preventing people from getting critical help. We'll break down what religious psychosis is, its causes, and how it is treated. So, what is religious psychosis from a clinical standpoint? First, it's not a standalone diagnosis. It describes psychosis where symptoms are dominated by religious themes. This involves two key symptoms: delusions, which are unshakable false beliefs, and hallucinations, sensory experiences that aren't real. A delusion might be the belief that one has a special mission from God or possesses divine powers. A hallucination is often auditory, like clearly hearing the voice of a deity giving commands. These experiences feel incredibly real, leading to isolation, distrust, and a rejection of medical help. This raises a critical question: what actually causes these profound, disruptive experiences? A major factor is psychological stress. Significant trauma or intense pressure can trigger a psychotic episode. It is also frequently connected to underlying conditions like schizophrenia or bipolar disorder. So does this mean religious belief itself is the cause? The evidence is clear: no. Religion doesn't cause psychosis. It provides the content for it in someone already predisposed. Think of it like a language. The psychosis is the condition, and a person's faith is the language it speaks. This is why it's vital to distinguish it from a spiritual crisis, which is an intense questioning of one's beliefs. Religious psychosis involves a break from reality, with delusions, hallucinations, and impaired daily functioning. Clinically, a belief becomes a delusion when it's fixed, unshakable, and outside one's cultural norms. But that phrase, outside one's cultural norms, is where things get complicated. How does culture fit in? Let's return to our opening idea. In some contexts, hearing a spirit is a normal, accepted experience. When symptoms are seen as spiritual gifts, it creates a barrier, delaying medical care for a spiritual one. This perfectly shows the content versus cause principle. The vulnerability is universal, but culture shapes the expression. This is why professionals must be culturally competent to avoid misdiagnosing profound faith as illness, or vice versa. Given this complexity, the biology, the psychology, the culture, how can someone possibly recover? Effective treatment is not one-size-fits-all. It requires a plan that addresses the whole person. Medication, mainly antipsychotics, is often the first step to stabilize brain chemistry and reduce symptoms. Psychotherapy, like CBT, then helps individuals challenge distorted thoughts and separate symptoms from reality. Finally, community and family support are vital to combat isolation and provide a safe recovery environment. This combination is key. Medication manages biology, therapy rewires thinking, and support rebuilds social connections. The most important message is that recovery is absolutely possible. People can manage their symptoms and reclaim their lives. Understanding this condition means seeing it not as a failure of faith, but as a treatable medical issue. For everyone involved, this understanding is the first step. It replaces fear with clarity and a plan for action. If this affects you or someone you know, seek help from a qualified professional. Share this video to help break the stigma.